Young onset dementia, also known as early onset dementia or working age dementia, is defined as any form of dementia with symptom onset before the age of 65. This age threshold is not biologically determined, but aligns with the typical retirement age, highlighting its impact on people who are often still in their working years and raising families. The condition can affect people as young as 45, with some cases reported even earlier. However, young onset dementia is less common, with a prevalence of about 0.6% before the age of 65, making it more difficult to study. Most research focuses on late onset dementia, but recent large-scale studies have included younger age groups, providing insights into this midlife condition. Omega-3 fatty acids, particularly DHA and EPA, are essential fats known for their anti-inflammatory and neuroprotective properties. They are found in fish oil, fatty fish like salmon, and supplements, and have been studied for their potential to reduce dementia risk, especially in older adults. Some large prospective cohort studies and meta-analyses with age-stratified data have provided impressive evidence for the association between omega-3 fatty acid levels and dementia risk in younger populations, particularly those under 65 years of age, and for interpreting the mechanisms of it. The most relevant and recent study is Plasma Omega-3 Fatty Acids and Risk for Incident Dementia in the UK Biobank study. A closer look, published in Nutrients in 2023. This prospective cohort study analyzed data from 267,312 participants, with ages ranging from 40 to 69 years, followed up to December 11, 2021. The study stratified results by age groups, including 50 to 59 years, which is relevant for young onset dementia, as some participants could develop dementia before 65 during follow-up. Key findings for age 50 to 59. Total omega-3 and all-cause dementia, 601 cases, significant inverse association. DHA and Alzheimer's disease, 210 cases, significant inverse association. DHA and all-cause dementia, 601 cases, significant inverse association. Non-DHA omega-3 showed no significant associations for AD or all-cause dementia. The study found strong associations in the 50 to 59 age group and in older groups, suggesting that the protective effect of omega-3s may be more pronounced in midlife. Given that young onset dementia can occur in this age group, for example, someone aged 55 at baseline developing dementia at age 60, these findings suggest a potential benefit in preventing young onset dementia. The hazard ratios indicate a 19 to 38% lower risk with higher omega-3 levels, depending on the type and outcome. Other studies provide complementary evidence, although they do not focus specifically on young onset dementia. Here's one. Framingham Heart Study, 2022, entitled Association of Red Blood Cell Omega-3 Fatty Acids with MRI Markers and Cognitive Function in Midlife, the Framingham Heart Study. The study looked at 2,183 participants, all free of dementia and stroke, with an average age of 46 years, focusing on the relationship between omega-3 fatty acids and brain health in midlife. It found that a higher omega-3 index was significantly linked to larger hippocampal volume, a brain region vital for memory. Although not directly focused on dementia, these findings suggest that higher omega-3 levels in midlife could support brain structure and cognitive function, potentially reducing the risk of young-onset dementia by preserving brain health during a critical period, offering a promising avenue for early prevention strategies. The protective effects of omega-3s likely stem from several mechanisms. Anti-inflammatory effects. Omega-3s reduce brain inflammation, a known contributor to neurodegenerative diseases, including those causing young-onset dementia. Neuronal support. DHA, a major component of brain cell membranes, supports neuronal integrity, potentially delaying cognitive decline. Vascular health. Omega-3s improve blood vessel function, reducing cardiovascular risk factors linked to vascular dementia, a subtype more common in younger populations. For individuals concerned about young-onset dementia, increasing omega-3 intake through dietary sources, such as fatty fish like salmon, mackerel, or supplements may be worth considering, especially in midlife. The UK Biobank study suggests benefits at levels associated with hazard ratios reductions of 19 to 38%, but consulting a healthcare provider is essential to assess individual needs and avoid potential interactions. The impact of young-onset dementia is profound, with major personal, psychosocial, and economic costs. Individuals are often at peak financial, familial, and occupational responsibility, with increased suicide risk, 2.8 times higher for ages 45 to 64. Diagnosis is often challenging due to the association of dementia with old age, leading to delays. The latest research, particularly the 2023 UK Biobank study, indicates that higher omega-3 fatty acid levels, especially DHA, are associated with a lower risk of dementia in people aged 50 to 59, a group relevant for young-onset dementia, with hazard ratios suggesting up to 38% lower risk for Alzheimer's. Omega-3 shows potential as a protective factor. However, given the rarity of young-onset dementia and the need for more targeted research, these findings are not conclusive, but provide a foundation for future studies and lifestyle considerations. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.